Thanks for coming in. We thought we'd come into the council chambers where we have a little more room to socially distance. We thought today, well, let me rephrase, several times we've gotten together with executives and leaders from the healthcare systems in Evansville to talk about what's going on with COVID. We thought the timing was right, given the fact that we've had a recent rise in cases. We think this is a really good time to remind people that while the economy is opening up, while businesses are opening to higher capacities, as people are out and about more and more, which is all good, there are some basic reminders that we need to keep at the forefront of all of our actions. One, masks are vital. These are so important. Social distancing, very important. If you can avoid large crowds, please do so. And of course, washing your hands as frequently as possible. All these simple things are important, especially as we approach the flu season. So I'm here today along with representatives from Ascension St. Vincent, Deaconess, and the Vanderburgh County Health Department to reiterate those points. And I know all these folks behind me would like to offer a few comments as well. So you can, James.
Good afternoon. I'm Dr. James Porter, the president of Deaconess Health System. I agree with the mayor. Just it's an important time to remind everyone in the community that we know what to do now. It's about not getting together in groups without protecting yourself with a mask, especially. And so we've seen, I think, a number of things happen. Schools are back in session. Universities are back in session. We have the Labor Day holiday. Youth sports are really up and running. All those things are bringing people together in settings where the virus is being transmitted more. So we are seeing an increase in the number of cases, an increase in the positivity rate, more people coming to the hospital for care. We still have capacity, plenty of capacity between both hospitals to provide care for these patients. But when we see the rates on the rise, we become concerned. We don't know where that's going to end unless we do something as a community to change it. So we do feel like it's important that as a community we take action now to get us off this upslope that we're currently on COVID-19 cases and try to get us more in a stable condition. Because as the mayor said, we all agree, keeping businesses open, keeping people at work, keeping kids in school, all important priorities for us. Some of the social activities I think that we've perhaps been enjoying and maybe not masking up as aggressively as we should is certainly something that we can change and should change in order to keep those important activities like people in school, restaurants open, and things like that. So we're really just here today to implore the community to double down on their efforts to make sure that they're protecting themselves and folks around them.
I have to agree with everybody else. We do need continued masking, continued distancing, continued hand washing, and please get your flu shot as soon as possible. There is some flu in the community. It's not widespread, but there are some cases, and it wouldn't take much to get it going, and I think the combined flu and COVID would really not be a good thing. So if it's at all possible, get your flu shot, and it should help. And there is a recent journal article that came out that showed people that had their flu vaccine had a less severe case of COVID. The flu does not protect from COVID, but it appears to add some protection during your illness phase of COVID. So, I agree with everybody else. Let's try to keep everything open. The really sad part of this is even though we went to 5.0 with the governor today, that really does not change the transmissibility or the lethality of the virus. I mean, that didn't change it. It's definitely going to open things up. It's going to be a little more of a risk when you go out. But as James said and as the mayor said, please avoid the large crowds and the large gatherings as much as possible. And I know there's going to be a lot of questions about going down the road, but thank you very much.
Good afternoon. I'm Dr. Heidi Dunaway. I'm the Chief Medical Officer for Ascension St. Vincent. I'd like to echo what Dr. Spear and Dr. Porter both stated, as well as the mayor. I think that, we're 6 months into the pandemic now, and we've been very fortunate in Southwest Indiana that we were not hit as hard as many parts of the country. But now we're seeing a trajectory, and particularly with hospitalizations, that are increasing. So as Dr. Porter said, we have the capacity to handle this. We can take care of the patients that we have right now. But it does send up some red flags to us that maybe we've become a bit complacent, and that we need to really, again, remind everyone, even when you're outside, if you're around other people, you need to be masking. You can still transmit the virus even if you're outdoors. You need to still follow those guidelines, distancing, hand washing, et cetera. And we need to act on this before we get too far down the road and before things become too serious. I also wanted to echo, we are already seeing influenza B cases. So please get your flu shot early. Encourage your friends and family to do so as well. It's really critical this year because we know, based on a lot of the data coming in, there is definitely potential for a much more serious illness based on a co-infection with both of these viruses. And we certainly don't want to start seeing that in this community as well. I think we can do this very successfully. We just need to pull together and remind one another that we need to stick to it. And in spite of the fatigue we may be feeling with the process, this is going to be with us for a while, so we need to be consistent. Thank you.
Question?
So if we're seeing flu cases already, are we seeing any COVID and flu cases at the same time yet?
We're aware of at least one.
Now, knowing this, Mayor, are you going to push any sort of stricter rules versus what the governor has laid out in his five-phase plan moving to stage 5?
Knowing what now?
So knowing that we have rising COVID numbers and there's at least one individual with COVID and flu, are you going to put any sort of restrictions in place or are you moving forward with the stage 5 plan?
At this point, we'll follow the state's guidelines on reopening. However, we will continue to track the numbers locally. One person with the flu, along with and having COVID, is one. If that number grows exponentially, then we'll certainly have a much greater concern. But we track the data on a daily basis, and we talk to our partners locally and at the state level on a regular basis. So right now, we'll continue to abide by the state guidelines.
I know you mentioned kind of avoiding crowds and large gatherings. We're seeing a mobile today with the ground zero decision, a lot of people gathering there. Do you have any comment or message to the people of Evansville tonight, just kind of moving forward in the next few days before all the decisions?
Can you just pull that back a little bit so I can understand?
So,
Thanks.
I know you mentioned large gatherings, kind of avoiding that. We're seeing that in mobile today from the
Okay.
decision. Any comment or message to people that
Sure. If as we've done with previous demonstrations and protests and rallies, that's fine. That's all of our First Amendment right, and we certainly encourage that in a peaceful manner, but we also encourage it in a safe manner. So if people are inclined to gather in large crowds, we do encourage social distancing if possible, but we also really implore people to wear masks, because we can express our First Amendment rights, but we can also do so and protect public health, and that's what I would ask people to consider.
We've heard a couple of times today that there is room to take care of patients, but can somebody give us a better idea of maybe how close to capacity we are? Are we in a danger zone, or?
We aren't close to capacity. I think one of the concerns we have is we always get busy and full with the flu season. We aren't typically this busy and full this early in the season. So with COVID already pushing those numbers up, when we look at what a typical flu season would be, we could definitely run into issues of having enough capacity in more widespread flu if we don't get those flu shots and do some things to get the COVID rates down now.
And I'm sorry, I have a hard time understanding. We are or we are not close to capacity?
We are not.
Thank you.
Yes.
Can somebody explain what this looks like, COVID and the flu? I've had both at this point, obviously not at the same time, and I can imagine what it's like. So can anybody tell us what this looks like?
Well, we don't really have much experience with it because influenza hasn't been circulating. I think in the southern hemisphere, it looks like the flu season wasn't a terribly severe flu season, which is good for us. But there haven't been a lot of reports of what COVID and influenza look like together. The symptoms are many times very similar, and it does make it more complicated for the people providing care to know what the best approach to treat it is, because you've got two different viral illnesses going on at the same time, both with their own potential complications that come along with that. So I think the most important message about influenza and COVID is we have an immunization for influenza. We should be able to prevent most people from having to deal with both infections at the same time. That's all about getting your flu shot.
Now, you said that the symptoms look similar. Are there any extra precautions or things that people need to look for if they feel like they couldn't have either one or both?
No, I think the actions that an individual will take would be the same, and that's just, seek medical attention if you're having symptoms that seem like they require that, and we would do testing then to try to sort out what was going on, whether it was influenza or COVID. I think that's one other issue. Another good reason to get your flu shot is because one of the challenges we've had as a state and a nation and a community is our capacity around COVID testing. If we're having to test a whole bunch of people who really have the flu to see if they might also have COVID, that's going to further strain that capacity around COVID testing. So we'd rather not have to be testing people who could have gotten a flu shot and prevented themselves from having that acute illness for COVID, when we like to focus that COVID testing on people that really do have COVID and have been exposed to COVID.
And Mayor, circling back to the question that was asked previously about the governor moving the state into stage 5, just your reaction to that announcement.
Well, certainly the governor and his staff are following data from around the state. So they feel that given the state positivity rate and numbers they're seeing statewide, that they're comfortable going to stage 5.0, with the caveat that it will be reevaluated in mid-October, which I think is fine. I think that caveat sends a strong message, and that message is if numbers start to go the other way, we could go back to stage 4.5 or something lower. So I think that's more reason to make sure if we want businesses to be open, if we want kids to be in school, if we want all the things we all want, then we really need to wear our mask, wash our hands, practice social distancing, and avoid large crowds when at all possible.
Are you willing to, if necessary, put more strict rules in place if numbers here in a little spike for some reason?
In 8.5 years, we've been really good about not speculating, and so we're not going to speculate on that. What I will tell you is what I said just a little earlier, and that is we will continue to follow the day-to-day data here and continue to have conversations with these partners behind us and with the state and evaluate those things on a daily basis.